what we're doing in HEAL is really actually returning to the roots of a community health center. My name is Hillary Mar Lopez-Nichols, and I am a mom, I'm a wife, I'm an artist, and I'm a clinic-based community organizer. My kid is one of the most important things to me in this world, and I want to leave the world a better place for him. And there's so much of what he's going to experience in life growing up with two moms and being biracial, and we're part of my growing up too. And I want to do what I can to kind of pass the baton to him and the next generation. There are times where people will look at HEAL and what we're doing with community organizing through a health clinic and think, wow, that's so innovative. And I always like to push back on that and say it's actually ancient. In so many communities, we're talking about Black communities, immigrant communities, queer communities, any community that has faced structural oppression has always engaged in political advocacy and community organizing to help with the health of the community.
What we have developed is a health association with a very high degree of local autonomy.
Our concept of health is to make social change, to build the institutions that can make social change and keep it going. So our task has been to organize people, to help them organize themselves, to encourage them to articulate their own needs, and then to give them the technical assistance to act to meet those needs. That's what a community health program is, and that's what we've been trying to do.
I remember very early on as a healthcare trainee in medical school, one of the factoids that's always stayed with me, which is that healthcare is about 20% of our health. So all the things that I've learned over 10 plus years about making people's bodies healthier, all of that knowledge, if I do it the best that I can improve someone's health 20%. That's it. So it begs the question of what's the remaining 80% then?
Buenas tardes. Mi nombre es Isabel Sánchez y pertenezco.
What we really need to be doing is not having the people in the ivory tower saying, well, this is what's important and this is what's important, but rather bring it back to the patients, the community, and say, what is it that you care most about? What is it that is impacting you the most? And to support that community, providing technical assistance, providing training, providing community, providing support, providing love around organizing alongside people in healthcare who work in the system to address our health at the political level.
También hablamos de fuerza y poder y vimos el video del movimiento de César Chávez y
It's interesting to talk about the start of the HEAL initiative because even though it started in 2014, I would say that the genesis of it is many years ago. Me and my family, we were interacting with the healthcare system a lot when I was a little kid. And my parents were immigrants to this country. I just saw firsthand all the different ways that the healthcare system was not set up for them. Like English was a learned language. Culturally, they were not a part of dominant culture or American culture. And every time I was in healthcare, I could just feel like the ways that myself and especially my parents didn't quite belong. I remember my first couple of weeks in medical school, that body feeling where I was like, oh, I don't belong, it came right back. And it was somewhere during that year that I remember I was talking to my partner, Allison. So she was doing at that point a lot of community organizing work. And I said, gosh, why is it that community organizing and healthcare have never come together? I did a quick history lesson and learned that, oh, actually, when you look at the original history of the community health centers in America in the 1960s, community organizing was a central focus of the original community health centers. And that was both really inspiring to me and really affirming.
Community health centers are built with the idea that, one, the community health center itself isn't separate from the community, that it is an integral part of the community. Two, that it has lots of things that support your health, the things that impact your income, childcare, education, transportation, safety, freedom, all of those things kind of under one roof.
The original community health centers baked in community organizing into their very fabric of what they do. For 10 years, they organized around clean water and voting rights and culturally specific foods.
About 50% of the people that live in the area have no on-site water. They usually have to truck water in.
And then, about 10 years later in the 1970s, healthcare insurance became highly privatized. And what that did was that it basically eroded some of those, what ended up being secondary functions of the community health centers, and it distilled it down to one function, which was the provision of healthcare delivery services.
What kind of a place are we? I think we're a place that has as its primary thesis that the determinants of health are in the social order, not in health care. I've never seen any use in what I call the Schweitzer bit, which is the idea that you stand around in whatever circumstances, laying hands on people in the traditional medical way, waiting until they're sick, curing them, and then sending them back unchanged and into an environment that overwhelmingly determines that they're going to get sick. We think there's a better way to do it by using health services as a route of entry for these other kinds of social change.
And I wish I could say that decades later things have changed, but we know that they haven't. We have created a financial disincentive to build thriving relationships in healthcare. My incentive is to spend no more than 20 minutes with you in an exam room. And I have less incentive than that to spend any time with you outside of the exam room. This moment that we're at in the American modern healthcare system is that we have to reckon with ourselves of, do we want to do the right thing of advancing health equity, which is building these different network of relationships where we can build power and work together to create the world that we want to see?
And so to have a program at a health clinic that is really a home for people's energy to want to do something positive and to change the world for the better, for their kids, for their grandkids, for whoever they care about, that Heal is a place where you can come to find a community to work with, to kind of see those changes that you want to see. we are trying to re-infuse community organizing into our community health center. Bringing together people from diverse experiences to work together to change laws, policies, structural level things to improve the health of our whole community. I think it's special to have something that is meant to be kind of a fixture and like a place that is always there for people to come and participate and be involved in social change and advocacy and organizing.